if you're sick, don't go out. Just stay at home, get well, get tested. Social distancing and very rigorous personal hygiene. If we all do that, we'll go a long way to keeping ourselves COVID safe. My name's David Wilkinson. I'm Deputy Vice Chancellor here at Macquarie University. I'm a physician by training and an infectious disease epidemiologist by specialist training. This is the fourth in our series of COVID updates, and it's the end of the first week of February in 2021. So there's a lot happened since the last update. The COVID epidemic in Australia now, as we all know, essentially there is no community transmission right across Australia. There have in the last week or so been 2 or 3 cases of quarantine breaches again, this time in Perth and in Melbourne. But apart from that, everything looks very positive across Australia. And certainly it looks, as we speak today, that there's no community transmission occurred as a response to those quarantine breaches, which is really good news. And we'll come to some of the implications of that later on. But as you can see on this slide for Australia, essentially we now have a flat line around COVID cases in the country. My next slide is showing the situation in New South Wales. We all know, of course, over Christmas we had a pretty disrupted Christmas, more for some friends and colleagues in the Northern Beaches and around Barala than others, but a couple of outbreaks there again, quarantine breaches, hotel quarantine breaches. But very well managed by New South Wales Health. Clearly, the outbreaks were brought under control very quickly. So here in New South Wales, we're now, at the time of recording, just over 2 weeks with no community transmission. So that's really good news, and hopefully, of course, that will continue. My next slide looks at the COVID epidemic globally, and we're now obviously in year 2 of the COVID pandemic. And the number of cases cumulative number of cases continues to grow. And as we all know, very, very difficult situation now in North America, very much so in Europe and the UK. Some early signs that a number of infections is falling, but the number of people in hospital is still huge across many of those countries. South America is being hammered. Particularly Mexico and Brazil, very, very, very challenging situations, essentially uncontrolled epidemics in those countries and health systems under enormous pressure. So very difficult to make any predictions, but this pandemic has got a long way to roll globally. So very importantly, what does this mean for the university? And I've put the key points up on this slide here. We're in a very privileged position in Australia, in New South Wales, and fingers crossed it will all continue that way. The key thing is we have to remain COVID safe, right? The key thing there is if you're sick, don't go out. Just don't go to work, don't come to class, don't go socializing. That's got to be our new normal. Focus on social distancing, focus on strict personal hygiene. And if you do have symptoms, get tested. If we all take that on board, we'll be in a very good situation. And that's the message for all of our students and for all of our staff. So semester 1 is about to start for 2021. Everything's as normal, apart from no large lectures with people sitting closely next to each other. But our intention is to have a near normal student experience, and let's call it a COVID normal, safe student experience. The same is true for staff. Staff need to be back at work now. We're in stage 3, as the Vice Chancellor has indicated recently in his email to all of us. It's safe for people to be back at work and essentially, again, back to COVID normal. I would make the point that we have a very important project underway, the Future of Work at Macquarie project. Staff have been given the opportunity to complete a survey around this, and I would urge people to do that. It's very important that we get a sense of your views on how work should look at the university going forward, so please do take that opportunity. Now, the big story, of course, for 2021 is vaccines. We're all seeing this almost every day, it seems, there's another vaccine approved. A year ago, nobody would have predicted we'd be in this situation now. As of this week, more people have been vaccinated against COVID globally than have had COVID globally. Right? The lines have crossed. It's an extraordinary achievement in terms of medical science here to have what is now 5 or 6 different vaccines approved in different parts of the world, being deployed in huge numbers. I mean, millions of people in the UK have been vaccinated. My sister's husband in London was vaccinated this week, and he's a fit, healthy, well 70-year-old. Quite extraordinary what's going on. The US rollout is really starting to gather momentum. Real trouble with deployment in parts of Europe, but you'd have to think they would get on top of that. Questions still remain. How long will immunity last for? We don't know. We'll have to wait and see. We'll have to see what the studies show. But I think people are hopeful that there will be durable immunity to COVID vaccination. Here in Australia, we've heard the federal government confident they'll start vaccinations later this month, February, and they've made commitments that all Australians that want to be vaccinated will be vaccinated by October. It's a massive logistical exercise, but we're a sophisticated, well-developed country with a very well-structured health system. So it should go well, and we can all feel, I think, very hopeful around vaccine deployment in Australia. Certainly, the university intends to play a role in this regard. We have applied for the hospital and our clinics to be part of the vaccine deployment network. So fingers crossed, and more news on that as it becomes available. The next slide is an interesting one, and I would encourage colleagues to look at it and the updated versions of Our World in Data, because it shows the different countries' achievements in vaccine deployment. And it's really very interesting. Israel is charging ahead. They went very early. They did deals with the pharmaceutical companies quickly. They're sharing data. And their Prime Minister has made the deployment a key part of his re-election promise. So it's interesting to see what happens. Different parts of the Middle East are going hard and fast. And as I mentioned, the UK is going really well at the moment. So that's very interesting to watch that. The next topic just to touch on, I think, is travel. This is very important for a lot of people, very important for our business in the university. Obviously, international students coming in, no sign of any of that happening probably for the rest of the year, quite frankly. A lot of our staff need to travel for research and for engagement purposes. That's looking very limited internationally for sure. More hopeful, I think, for interstate within Australia, although it's very difficult for any of us to plan everything, and many of us had holiday plans ruined over Christmas, unfortunately. And it's very problematic, I think, when state borders close at the drop of a hat. I'd like to just close off this video with a couple of important little issues, I think, that are worth reflecting on. I've put this slide up here. I'm not going to touch on the issue of masks. We talked about that last time. I will just mention that these new variants that we hear about are real, and this is definitely happening. Viruses do this. They do mutate, so it's expected, and some of them are definitely more infectious, right? There is no question about that now. And there's a little bit of hint that one or two of them may actually produce more serious illness, but it's nothing more than a hint at this stage. There's some very interesting debate going on around the cost effectiveness of lockdowns and responses to this. And I think that the sense coming out is let's make the responses proportionate. We're spending vast amounts of money on this, and we need to keep it in balance. There's some interesting work coming out on immunity tests for COVID, still essentially in the research phase, as are the developments of so-called COVID passports, where you prove your vaccination status. My bet is that's going to be a normal part of our lives going forward. I reckon that international travel is not going to be possible without a COVID vaccination and proof of immunity. And The other thing I just wanted to flag, and I share this on the next slide, is this measure that I touched on in a previous video of excess mortality. So just as a reminder, it doesn't really matter how many people get infected with COVID, because almost everybody doesn't get sick, or certainly doesn't get seriously sick with it. What really matters is how many more people die from an epidemic like COVID than would normally die in a year. This graph tells you that story in the blue line for England and Wales and the red line for the United States. Anything that is above the very bottom line there of 0% is excess death. And you can see here really, really problematic situation for England and Wales and the United States. And these are genuinely people that would not have died if there had not been a COVID epidemic. And importantly, they are people who are dying both from COVID and non-COVID causes, for example, disruption of the health system. It gives, and the numbers here, you know, the red line for the United States is bobbling around 20% over the year. So 20% more deaths throughout the year, last year in the United States, than there would have been. And these are very large numbers. So let me show you that on the next slide, which looks at actual numbers of deaths in the United States. All of the lines in grey and blue at the bottom are prior years. And if 2020 had been a normal year, the red line would have been mixed in amongst those other lines. That's the key point here. You can see the red line is way above those other lines, and the blue is the average for the last 5 years. And the numbers are enormous. So back in March and April, there were 75,000 excess deaths in that month. And now you can see how in November, December, the end of last year, the numbers had gone up again, 70 to 75,000 excess deaths. So again, these are deaths that would not have occurred if there had not been COVID. Some of them are directly COVID, some of them are non-COVID, but due to the disruption that the COVID epidemic is causing. I have one last data slide to share with you. In one of my previous videos, I mentioned South Africa because I've worked there for 10 years and they have great data. And if you look now at the excess deaths in South Africa, it's a very, very troubling situation. So here again, the orange line is the previous 5 years, and the black line is the excess deaths that have occurred in South Africa. There was a peak in the middle of 2020 with about 15,000 excess deaths every week. And then it all settled down and nobody really understood what was going on. The questions then were, well, why is the epidemic not affecting Africa? And it's suddenly come back, and it's come raging back with a very big peak of excess deaths in South Africa. There is a sense that it's starting to settle again, and that we need to watch that carefully. But I wanted to share these data because I think it's important that here in Australia we appreciate very strongly that the privileged position that we're in is not reflected in fact much of the world. And I think there's a long way to go in that regard. So in my very final slide for this video, just in conclusion, a few quick points. I mean, obviously the COVID pandemic continues. I think it does have a long way to go. It's going to play out for the rest of this year, that's for sure. No doubt there'll be more surprises to come. That seems to be a feature of this. Around the world, many more infections, many more hospitalizations, and many more deaths. That's inevitable. There's real hope around vaccines. These vaccines really seem to work. There are several of them. There are various glitches around production and deployment and distribution. That'll all get sorted out. We're very good at logistics around the world, moving stuff around. But much to learn, right? You know, how long does immunity last for? How much does it protect us? How much does it stop further transmission? So all of that still needs to play out. Clearly, we're very well placed in Australia, and particularly in New South Wales. The pressures on the university continue, but again, you know, we're managing those well, I think. close with the same key messages that actually we've been hammering home now from the very beginning of the pandemic. If you're sick, don't go out. Just stay at home, get well, get tested. Social distancing and very rigorous personal hygiene, washing your hands, etc. If we all do that, we'll go a long way to keeping ourselves COVID safe. Thank you very much.